What is ultrasound imaging? Ultrasound is safe and painless and produces pictures of the inside of the body using sound waves. Ultrasound imaging, also called ultrasound scanning or sonography, involves the use of a small transducer and ultrasound gel placed directly on the skin. High-frequency sound waves are transmitted from the probe through the gel into the body. The transducer collects the sounds that the bounce back, and the computer then uses those sound waves to create an image. Ultrasound examination do not use ionizing radiation, thus there is not radiation exposure to the patient. Because ultrasound images are captured in real time, they can show the structure and movement of the body's internal organs, as well as blood flowing through blood vessels. Also known as a pulse echo technique. The technique is similar to the echolocation used by bats, whales, and dolphins, as well as sonar used by submarines. In ultrasound, the following events happen. First, the ultrasound machine transmits high frequency, 20 MHz, sound pulses into the body using a probe. Second, the sound waves travel into the body and hit a boundary between tissues. Example, between fluid and soft tissue and bone. Third, some of the sound waves reflect back to the probe, while some travel on further until they reach another boundary and then reflect back to the probe. Fourth, the reflected waves are detected by the probe and relayed to the machine. 5. The machine calculates the distance from the probe to the tissue or organ using the speed of sound in tissue and the time of each echo's return. The speed of sound in air is 330 meters per second. 6. The machine displays the distance and intensities of the echoes on the screens, forming a two-dimensional image. All the energy comes from the transducer. All we see are reflections and scatter of the ultrasound waves. Sound. Sound waves consist of mechanical vibrations containing condensations and rarefactions that are transmitted through a medium. Sound is mechanical. Sound is not electromagnetic. Matter must be present for sound to travel. The transducer, piezoelectric crystal, converts electric signals to mechanical and mechanical to electric signals, transmit pulses of sound into tissue and listens from echoes. Most of the time is spent listening for echoes, approximately 80% of the time. Ultrasound pulses making the image. Echoes occur when pulses of ultrasound hit reflectors. A stream of echoes from each pulse return to transducer. Deeper echoes from deeper tissues arrive later. Stronger echoes arrive from stronger reflectors. Each transducer has many elements, each making pulses between 150 to 200. Ultrasound imaging is used to follow the development of a pregnancy. We can watch the fetus using ultrasound at the 8 weeks gestation, as we can see in this picture. Ultrasound imaging, fetus feet. This is a 2D ultrasound scan through the foot of a fetus. You can see some of the bones of the foot. We can process the image in a computer to find the outline of the foot. This is called surface rendering, as we can see in the right image. Here are more examples of surface rendering. Can also be used to see the heart. Doppler ultrasound. It's a special ultrasound technique that evaluates blood flow through a blood vessel, including the body's major arteries and veins in the abdomen, arms, legs, neck, and head. Doppler effect changes in a wavelength with speed. If a surface of sound moves toward the listener, the waves begin to catch up with each other. The wavelength gets shorter, and so the frequency gets higher. The sound has a higher pitch. We use this principle to work out how fast blood cells move. Ultrasound reflects of the blood cells and causes a Doppler shift. The ultrasound probe emits an ultrasound wave. A stationary blood cell reflects the incoming wave with the same wavelength. There is no Doppler shift. The ultrasound probe emits an ultrasound wave. A blood cell moving away from the probe reflects the incoming wave with a longer wavelength. In reality, there is actually two Doppler shifts. The first one occurs between the probe and moving blood cell, and the second one occurs as the red blood cell reflects the ultrasound. Now, the blood cell moves towards the probe. It reflects the incoming wave with a shorter wavelength. There are three types of Doppler ultrasound. First, color Doppler uses a computer to convert Doppler measurements into an array of colors to show the speed and direction of blood flow through a blood vessel. Second, power Doppler is a newer technique that is more sensitive than color Doppler and capable of providing greater detail of blood flow, especially when blood flow is little or minimal. Power Doppler, however, doesn't help the radiologist determine the direction of blood flow, which may be important in some situations. Third, spectral Doppler displays blood flow graphically in terms of the distance traveled per unit of time, rather than as a color picture. It can also convert blood flow information into a distinctive sound that can be heard with every heartbeat. For example, in the carotid artery, Doppler imaging looks at artery, get image and trace of blood flow. This is also a carotid artery. Here, the flow is not healthy. Here is how Doppler sounds and looks. Modes of sonography. Several modes of ultrasound are used in medical imaging. These are A modes. A modes, amplitude mode, is the simplest type of ultrasound. A single transducer scans a line through the body with the echoes plotted on a screen as a function of depth. Therapeutic ultrasound aimed at a specific tumor or calculus is also a mode to allow for pinpoint, accurate focus of the destructive wave energy. B mode or 2D mode. In B mode, brightness mode ultrasound, a linear array of transducers simultaneously scans a plane through the body that can be viewed as a two-dimensional image on a screen, more commonly known as 2D mode now. M mode. In M mode, motion mode, ultrasound, pulses are emitted in quick succession. Each time, either an A mode or B mode image is taken. Over time, this is analogous to recording a video in ultrasound, as the organ boundaries that produce reflection move relative to the probe. This can be used to determine the velocity of specific organ structures.